Well, good afternoon. This is Pat Kelly speaking to you from Owen Sound, Ontario. It's just after 1 o'clock my time, and I apologize for the slight delay. We had some minor technical issues, but we are here today to bring you stories from the PH Registry. Here joining me today for our webinar is Frida Tom, and Frida is with the Canadian Pulmonary Hypertension Registry in Vancouver, BC at the University of British Columbia, and she is the project manager. So we will be about an hour for today's presentation, and we welcome you today. If you have any questions or comments, please feel free to put them in the chat or make note of them, and we're going to leave time at the end of today's presentation so that we can have some dialogue back and forth and hear from you, any questions or comments or concerns that you have. So welcome to our webinar. I am going to start with what's the purpose of today's webinar is to share with you some learning specifically about what the PH Registry is here in Canada, how it contributes to research, care, and treatment. We have some stories we want to share with you from the registry, and to answer questions that you might have about confidentiality and privacy. And those, we're really fortunate to have Frida with us today because she manages those ethics concerns for the registry. And then we want to talk a bit about how patients can be involved, not only in the registry, but in other aspects of research in PH. So I thought we'd start with just a simple explanation of what disease registries are. They are important sources of real-world evidence, and by that we mean evidence that is often collected in clinical trials is very structured and very defined. But in the example of registries, we have evidence and information and data about patients that is collected over a much longer period of time, and it's collected in clinical practices when you have appointments with your clinician or your nurse. And they help to inform clinical practice because we see what happens to patients over the long term and even when they're finished in a clinical trial. So much of what we know about pulmonary arterial hypertension has come from studies from national or international registries. And we're going to share some of what those findings are and hear from one of the researchers here with our PH Registry. So I thought we'd start also with a short video about what. Sorry.
A registry is a
Can you see
tool
this?
for helping research. A registry is used to collect and store information about a disease or condition, a procedure, a treatment or medical device, or an individual's experience living with a condition or set of symptoms. Different registries collect different types of data, such as clinical lab results or scans, or how a rare condition may change over time. Sometimes clinicians contribute data, sometimes patients, and sometimes it's both. Patient registries help the rare disease community by providing valuable information to doctors and scientists to help develop treatments, and to patient organizations to help advocate for resources, support, and therapies that change lives. This information can be critical in identifying candidates for clinical trials, building connections among patients, supporting research goals, or helping to develop standards of care for patients. So, why would you want to participate in a registry? It's a chance to tell your story, to participate in a community, and to contribute to a cure.
So I think that little video helps to give us an introduction, a quick introduction, but we wanted to talk specifically about what is the Canadian PH Registry. So I think one of the key questions people want to know is, how do I know if I, as a PH patient, am in the PH Registry? And the easiest way to find out is, of course, to ask your doctor or your nurse. You may already know if you've been participating in a clinical trial or so on. But you can also, if they say that you're not actually in the registry, you can certainly ask to be included. And if you are in the registry and you decide for any reason at all that you no longer want to be included, you just have to let them know. You don't have to give any reason at all. Frida, is there anything else you'd like to add to that? Because you are the person that manages the registry here.
Yes, I just also wanted to add that you can either tell your doctor or nurse verbally, or you can also put it in writing. It's your choice. And once you decide that you no longer want to be part of the registry, you actually have two choices. You can have all the data collected from you destroyed, and or the other choice is that you can also have all the data that had been collected to you to that point where you withdrawn stay in the registry, and then there won't be any other data collected from you afterwards. This will all be explained to you when you approach the doctor or nurse regarding your choice.
Thank you, Frida. That's very thorough. So why do we need a PH registry? Well, this enables us to collect data on as many patients as possible. And by doing that, especially in situations for rare diseases, it makes it helps to accrue enough data to be able to draw conclusions. And that improves the quality of the research by having more patients involved. So what kind of information is collected? Certainly your diagnosis details, for example, when you were diagnosed, what tests were done, results of the first right heart catheterization, your current clinical status, how much trouble you are having with the 6-minute walk or other tests, and have you been in the hospital or an emergency room, and what are your current medications? Any follow-up information is also included. Has there been a change in your status or stage of disease or type of treatment? And it also collects some personal identifying information that helps to keep track of you. But again, that personal information is not made available to any of the researchers or clinicians or anyone else that is viewing your data. So where is it stored? It's actually stored in a secure server at the University of British Columbia in Vancouver. And this is an institution that has had decades of experience in clinical trials and studies and keeping research data secure. And again, I'll just restate, the registry does not release any of your identifiable information to anyone else, and it's stored on this password protected computer indefinitely. So how does that personal information get protected? Data is collected at your PH center. It doesn't include any personal identifying information that is coded or encrypted before it is shared with the researchers. And we use similar technologies to transfer money or to pay our bills online every day. So whether we realize it or not, we are using encrypted and coded data and sharing confidential information in other ways on a day-to-day basis. Frida, is there anything else you'd like to add to this about changing our minds, for example?
Sure. I just also want to let everyone know that if you're not familiar with research studies, whenever you participate in a research study, your name will not be put on any type of research-related documents. It's actually going to be a unique number that will be created for you. And this unique number will not identify you. It will not have, say, your SIN number, your personal health number. As for when Pat mentioned in one of her bullets, it will not be shared with researchers. Yeah, so what had happened is that all the data that will be shared with other researchers across Canada who is a participating site at the registry, it will be de-identified, the data. And this will only be transferred using the UBC OneDrive. So again, it's a secure, I guess, way of sharing the data. So it'll be going through UBC at this point, and only UBC OneDrive.
So, for example, an insurance company or a future employer, they would have no way of finding out this kind of information about you. Okay, well, thank you, Frida. So who would see my information? Only those staff members directly responsible for the registry and the study coordinator who has access to patient information. And again, that's Frida, who's with us today. And the information may be used for your care in the clinic or during a research study. And after that, no one else will have access to all the data, including the identifying information about you. So now we want to share some stories. What actually happens to people who participate in the registry? And I think this is a question that people often have, because if we can't identify who those patients are who participate, how do they find out what's happened? So we thought we would share with you some stories from our registry. And these are kind of collective stories. These are the stories of hundreds of people who have contributed information. But I'd like to start with an introduction to one of the researchers who has actually conducted research using data from the Canadian PH Registry. So next slide, please, Kim, and it's going to be a video of Dr. Brunner.
I'm part of the PH clinic over there. I've been there for about 10 years now. It's a pleasure to speak with you regarding registries. We're lucky enough to have a national registry. It's been in progress for about 5 years now, and we've been collecting data prospectively. We've learned a lot from the registry so far, and we look forward to learning more. Registries are important. They are an important complement to clinical trials. Clinical trials are very important, but the environment's very structured. Their research coordinators are looking in, things are very controlled. The registry data lets us know how things are going in the actual real world environment with all of the challenges associated with real world medicine. Highly grateful for participation from patients. You know, we wouldn't learn as much as we would without being able to learn from patients, learn with patients. And you know, we've been fortunate to publish a couple of papers on the basis of the registry, and some local and some national, getting them into good journals, and really showing the world how we practice pulmonary hypertension care in Canada, and learning from our experience to make care better for all patients in the country. And thank you so much for your participation, and you know, I look forward to working with the registry and with everyone in the future.
So Dr. Brunner, as I said, is one of our researchers who's actually used the data, and we wanted to share with you a couple of the studies that that he's conducted. This first one here is the question that they were asking: does community size or commute time affect severity of illness at diagnosis or quality of care in a centralized care model of pulmonary hypertension? And I think, as most of you will probably already know, the treatment of pulmonary hypertension in Canada is centralized in centers of excellence. But of course, if you don't live within easy commuting distance of one of those centers or one of our major cities, you probably wondered, does the care differ if I'm in a remote area, or if I have a long commute time to that center? So that was the question. And of course, this is a question that came probably from a patient, from patient-oriented research. What are the questions that patients are asking and want to have answered? So this was the question that was posed, and the study was done. And the question was, it was unclear how the commute time would affect patients who live in rural or remote places. But the findings, and these are findings based on not 2 or 3 or 10 or 20 or 100 patients, but on 342 patients. So because of that, the researchers were able to draw conclusions. And what they found was, and this should be reassuring, there was no association with the severity of illness at diagnosis on the right heart catheterization. They found no change in the type of care, the follow-up tests, or the low risk status. So patients who live in rural or remote areas do well with centralized care. So I think that's a really reassuring finding from this study. Frida, was there anything you wanted to comment on here, or we pretty,
You pretty much covered it. Yeah.
okay. So let's take a look at another question that was asked utilizing data from the PH Registry. So our next slide, Kim. So this question again was asked, was based on the concern. What is there association between average income and the severity of pulmonary hypertension at diagnosis and the risk at follow-up in a public healthcare system? So patient income has often been associated with clinical outcomes in pulmonary hypertension. And in the tertiary care center where this study was conducted, again, it was in Vancouver at UBC. It's a large tertiary referral center. It operates, of course, in Canada, where we have a publicly funded healthcare system. And what they found was a trend towards less advanced disease at diagnosis and significantly lower risk at follow-up for patients with higher income levels. This suggests that even in a public healthcare system, higher income is associated with better outcomes in pulmonary hypertension. And this was a study that was conducted, again, not with just a handful or a dozen or 100 patients, but with 344 patients. So this represents a significant and valid finding. Frida, was there anything you'd like to comment on here?
No, actually, you're doing a great job in explaining it, because sometimes, when we see publications or abstracts, the language can be a little bit complicated. And no, you've explained it well in lay language, Pat.
Yeah, well, we actually had, there was a concern about the final summary and comments from this slide. So we did go back to Dr. Bruner just to clarify, because I think that's something that patients want to see, is when studies are published, they are published for a pretty sophisticated audience. They're usually published for other researchers and clinicians and to be published in a scientific journal. But that doesn't always easily translate into language that's understandable. And so we want to make sure that the knowledge about new research gets transferred to the people who have such a significant interest in, and that is patients and their families. So we're working hard, I think, at PHA Canada to make sure that we share information in a way that that makes sense for patients and families. So how does it help me or other patients when I join the registry or a clinical trial? Well, I think we've already seen one of the benefits is things move faster in terms of getting a clinical trial to completion, because you're able to find more PH patients. They're not just the ones at one center. They may come from many centers or even outside of centers. It pulls valuable information together quickly, and we're able to track people, as Dr. Bruner said, in real-time evidence over a longer period of time. So it's not just confined to 1 or 2 or 3 months or 1 year that is often the timeline in a clinical trial. So it's a longer timeline. And you're able to identify as well patient priorities for research, as we've seen in the 2 studies, that the stories that we talked about. Those were probably questions that patients were asking as well as the clinicians. And we're able to assess risk and connect patients to clinical trials, because we know where they are and where they are in their PH journey. And we're able to provide data for researchers so that conclusions can be drawn that help to advance our understanding of the disease. So how can patients get involved in improving PH care? And many of you who are on our webinar today, I think you're already involved. Just by participating in this webinar, for example, you're increasing your understanding and your knowledge about the illness. And by participating in research, you're helping to share information and experiences and helping to inform the kinds of questions that are asked. By joining patient groups, you have a role to play. You might not want to contribute in a PH registry. You might not want to join a clinical trial, but as research progresses, there may come a time when it's of interest to you or someone that you know. And just providing feedback about your experience with certain medications or health technologies, or the experience of participating in conferences and webinars. Just providing your feedback helps to improve the quality of content and the quality of the meetings and events that we host. And by sharing your data, sharing your health data, again, with appropriate privacy protections, you help to contribute to the body of knowledge about real world evidence. And again, I think it's important to restate, whenever you participate in a clinical trial or a conference, an event, a registry, you always want to get the information that you need that helps you to feel comfortable about how your privacy and confidentiality are going to be protected and how you will be impacted by a study. So asking questions, and I think we heard from Dr. Brunner real strong reassurance about the value that patients contribute to research, that it's only through patients' participation that advances can be made. And that is time for questions. And I'm glad we were able to move fairly quickly past our technical bump, because we'd like to hear from you on our webinar today, on our call, and with any questions that you'd like to have addressed, or anything that you'd like to have clarified, or suggestions that you have. So Kim, I think you're helping us to.
Yep. So Beth has a question here. So Beth wants to know if there is anywhere else that she can ask besides the clinic, just to know if they're actually in the registries or anywhere else that they can get this information.
I'm going to turn that over to Frida.
Yes, hi. I just want to let everyone know that currently there is about 11 sites across Canada. So depending where you live, you can ask your physician or the nurse that works with the physician if you are in the registry or not. So I can, if it helps, I can run off the sites. So I'm going to start from West Coast to East Coast. So here in BC is the Vancouver General Hospital. There is a site in Edmonton, one in Calgary, one in Winnipeg in Manitoba there. There's a few in Ontario, which is Hamilton, London, and Toronto. And then there is one in Quebec, in Laval, Quebec. Another one is in Moncton, New Brunswick. There's in Halifax, Nova Scotia, and the last one is St. John's, Newfoundland. So if you're in, Beth, if you're in any of those cities, please ask your physician or their nurse.
And Frida, if patients are outside of those centers, they're being seen and treated outside of those centers, would they still be eligible to participate in the registry if they were seeing a respirologist or cardiologist somewhere in a small town?
Currently, my answer is going to be no for now, but we can figure something out. If you can let me know where you are, and if you're interested, I can contact the site that is closest to where you live, and we will have to work out the logistics in accessing your patient records.
Oh, thank you, Frida. So if anyone would like to get in touch with Frida, if you just email me, pkelly@PHA that's up on the screen there, .ca, and I'll pass that along to Frida. Okay.
And plus, we're also continuing adding more sites across Canada to the registry.
Mm-hmm. Well, actually, that's part of the project that I'm working on, and part of this registry. So PHA Canada was fortunate to secure some grant funding last year to create the research capacity building project. And the project has 3 pillars. One of them relates to building patient education and leadership with specifically with with our ambassador workshop series, but also making resources available to our volunteers and patients. So building the capacity of our patient community to participate in patient-oriented research. And this webinar is part of that. Building the capacity for our clinical trials network, specifically in PH research, and that's being led by Dr. Jason Weatherall in Alberta. I don't lead that. I support the expansion of the registry, and then supporting the development of the clinical trials network. And the last is supporting the development of the registry. So with Dr. Brunner, Dr. Swiston, and Frida, and others who are involved in expanding the availability of the registry. So there's a very dedicated effort on behalf of PHA Canada to support the expansion of our research efforts.